inviting me here. So, a very good morning to everyone. Myself, Anupriya. I welcome you all on behalf of IHMA Kerala State Chapter. So, IHMA Kerala State Chapter has conducted a series of 50 sessions of Season 1 free webinar series. This is Season 2 of free webinar conducted by IHMA Kerala State Chapter. So, dear delegates, only permitted recording alone will be uploaded on the YouTube. So, some recording consists of information of patient which couldn't be disclosed in the internet. So, I request all the delegates to make fruitful use of all the webinars. So, today as a speaker, we have Dr. Saptarshi Banerjea. So, no needs for more introduction. So, I just wants to go in a little flashback story. So the story started in 1846 when there is no homeopathy college in Calcutta. So the first generation Dr. Calcutta Banerjea, Subrata's great-grandfather, was born in a town near Calcutta in year 1846. After getting interest in homeopathy, he goes on studying and practicing homeopathy. And the second generation, Dr. Kishori Mohan Banerjea, Subrata's grandfather, was born near Calcutta, year 1846. So he learned homeopathy from his illustrious father. He founded College and Homeopathy Hospital, Bengal Allen Homeopathy Medical College and Hospital, year 1924. By then, the city Calcutta reputed as the Mecca in homeopathy. So the third generation, Dr. Navakumar Banerjea, uncle of Dr. Subrata Kumar Banerjea, he was principal of Bengal Allen Homeopathy Medical College and Hospital, year 1941, and practicing homeopathy for 34 years. He has master of prescribing miasmatic approach, and Dr. Ranjit Kumar Banerjea, Subrata's dad, a microbiologist. Now the fourth generation, Dr. Subrat Kumar Banerjea, a successful clinician and lecturer of worldwide, achieved many laurels and crowns. And today as a speaker, we have the fifth generation, the young inspiring talent, Dr. Saptarshi Banerjea, Gold-Medalist, B.H.M.S honor in the 9th subject of Health University. He achieved first position in All India MD entrance exam, as well as first position in MD final exam, visiting lecture at Urban Holistic Institute, Bangkok, Thailand, Associated Director of Bengal Allen Medical Institute, and conducted a post-grad programs in Tokyo, Japan, USA, Canada, and many more. So Dr. Saptarshi is a popular young lecturer. His dedication towards homeopathy is incredible. So on behalf of IHM Kerala, I welcome you, sir. Please take over the session. Thank you so much.
Thank you very much for the kind words. I welcome everyone, those who are joining in from India. If anyone is joining in overseas, good afternoon, good evening from any part of the world you are joining in. And to start off, you understand it's quite a difficult time for everyone, not just living in the subcontinent, but anywhere in the world. It's obviously has been a tough time, and people have to change their lives in different ways. What I will be sharing with you over the next 1.5 hours is perhaps we are not being dealt with that at the present moment, but in months, in the year to come, we'll be facing a lot of that, and we have to be able to cope up with it. You understand many cases of COVID-19 today is sometimes self-limiting. Patient is getting better within a period of time if they have a good immune system. But those who are suffering from it, they are undergoing tremendous emotional challenges, which they're not facing maybe immediately, but as time progresses. Also, if you understand, those who have been affected by it in an indirect way, maybe perhaps not from the disease, but from the emotional setbacks associated with it, again, you'll be facing quite a lot of challenges in the months to come. You'll find people coming to you with anxieties, which is there now, which will be there in months to come. You'll be facing people presenting with a lot of clinical depression. because the way of life as we know it has changed. Perhaps we don't know when we'll be back to what was presumed to be normal. And you'll be facing people who will be coming down with a lot of fatigue and chronic stress. So, my friends, if you understand about a pandemic, obviously it is the cases of a pandemic, it is the number of cases which people are encountering day in, day out, countries are encountering. That is obviously one of the parts of a pandemic. But to be very precise, you have to understand that when a pandemic is going to end is when people have got over the emotional effects of the pandemic as well, the anxiety surrounding it, the fear surrounding it. So you have to understand there's always a physical effect of the pandemic. There's always that emotional change which a human being undergoes as a consequence of this pandemic. And I've read quite a lot about the 1918 pandemic as well. And also in those times, there were obviously symptoms and people were dealing with the symptoms of the pandemic. But it's that fear of the pandemic when that's going to go away. And that is also a very important feature. So I'll not just be sharing with you the disease or the physical effects, but a far important factor is the disease which won't be tested in the kits and which won't be come up with the blood tests is the emotional effects of pandemic. So as you understand, it's not a condition which is very prominent perhaps today, or maybe some of you have come across it. But as the months are going by, you'll find people coming down more with emotional health problems, more with emotional issues, rather than being down with physical issues. And we as homeopaths, you understand, we have a greater scope, we have a greater ability to handle that condition. Think of a person with anxieties, think of a person with loneliness, think of a person with insecurities. And you understand all these are important words which you will find mentioned in Materia Medica, irrespective of whether it's a pandemic or not. And my aim for the next 1.5 hours is going to share with you remedies with which you can handle these critical situations. Because I'm sure you have read many articles, heard many webinars about handling COVID and the symptoms of COVID, but I'll be sharing with you the road ahead and what I am facing, and I'm sure you'll be facing in today's 21st century as well. You understand, people do not give you, like, it's not a mathematical calculation. People will be giving you either symptoms of debility or symptoms of stress or symptoms of depression and loneliness. Is sometimes a very mixed picture, and it's important to understand the key factor as we go ahead. So, when I'm sharing with you post-COVID debility or post-COVID stress, it doesn't mean, immediately 2 weeks or month after. It can be going on for months. You think if it started in March, it's August now. So it's about 5 months, 6 months going ahead in the next year or so. How people are going to deal with that situation and how homeopathy can help in those cases. My friends, one of the very important factors is debility. And it can be the debility, not only the mental debility, but also the physical weakness as well as a consequence of suffering from COVID. You'll find people after COVID may be suffering from acute weakness, but even long-term effects of weakness. My first remedy to help you in that condition is Alstonia scholaris. I've used this medicine very extensively and been using it, especially in this situation where patients had COVID or COVID-like symptoms. Perhaps they didn't get themselves tested, but there's a lot of ensuing debility and weakness, which is quite persistent. If you have your Borica's Materia Medica with you, you will find it's mentioned a tonic after exhausting fevers. So sometimes in cases of COVID, you're finding cases where there is a diarrheal discharges, where there is a lot of diarrhea. But after that, there's a lot of ensuing debility you will find, and that's quite important for Alstonia scholaris. If you have a quick look in Borica, you'll see it's mentioned a tonic after exhausting fevers. And I want you to really try this medicine. If you look, I'm just reading from Borica, malarial diseases with diarrhea, dysentery, anemia, feeble digestion, a tonic after exhausting fever. So sometimes you're coming across cases where appetite has not returned, where the debility is quite prominent. And in those cases, Alstonia can really, really help you in those conditions. And it's not just there has been profuse loss of vital fluids. It's just can be, you know, like diarrhea 2 or 3 times. And then after that, they have recuperated from the fever, or even if the diarrhea was not there, this was just the fever and they've recuperated from it. And still there is a lot of weakness and low appetite as well. Another remedy which comes very close to Alstonia is cinchona. Why cinchona? In case of cinchona, if you understand, there's a lot of loss of vital fluids. So there was this diarrhea, or there was a lot of vomiting, and after that there is a lot of debility. You think of China. But in case of Alstonia, it's just the fever which has been there, and post the fever, there's a lot of weakness and there is low appetite, and that's important. And so it will help you again, you know, post-COVID debility, which is quite important. Potency wise, you can use 6C, you can use 30C. If you're in the subcontinent, other tinctures, if are available, you can use in tincture as well. But if you're joining in for abroad, 6C and 30C are good choice of potency to help you in this condition. And I want you to please try Alstonia. I'm sharing with you the ones which I have used and been using it in the recent times and has proved effective. My next medicine in this list is Avena sativa, another fantastic medicine which you'll need very commonly in today's condition. Think of someone A who had the viral infection, or they had the COVID, and post that there's a lot of debility. A. B, post that condition, they cannot sleep, insomnia. Or, you know, think of someone who is in this, who is working from home, who is working 4 weeks, 5 weeks, 8 weeks, is going on week after week after week. And in that condition, where you're finding there's a lot of debility, there's a lot of insomnia, it's like a chronic fatigue, it's more like a nervous fatigue. That's why if you see in Avena sativa, it's a medicine for neurasthenia. What do you mean by neurasthenia? There's a nerve exhaustion. So not being able to continue the circle of existence. And believe me, my friends, a lot of people who are working from home, who are in the IT world, or, you know, stuck in the cycle of work for 5 days, 6 days a week, again joining back on Monday without any changes, they're suffering from this nervous fatigue, neurasthenia with insomnia. And that's a fantastic condition for Avena sativa. So A, you can come across cases where post-COVID, they had a lot of debility. They are coming down with a lot of weakness. You understand any viral illness, especially in this condition, there's a lot of debility which ensues, and you have weapons at your hand to help you. People are going for tons and tons of vitamin C's and, you know, supplements, but you have homeopathic remedies at your disposal to help you in that condition. Try Avena sativa, tonic after exhausting diseases. And Avena has helped in that condition. So post-COVID, you're having a lot of debility. Secondly, in cases where there is no contact with COVID, or, you know, no contact with the patient, but still you're coming down with a lot of fatigue, with insomnia, you can't sleep, you know, You had a good, you're working 8 hours, 7 hours, normal working hours, but still you can't sleep. Insomnia, nervous debility, neurasthenia. And that's very important for Avena sativa. And what do you mean by neurasthenia? Patients will not come and tell you, I have neurasthenia, will they? But what you can get, I have tingling in my hands and soles. I have numbness, I numb feeling in my hands and feet. I feel like an ant is walking under my skin, formication. So newcomers who are joining in, young graduates, do remember neurasthenia. Whenever you come across that in the Materia Medica, numbness, tingling, formication. These are the three things which comprise neurasthenia. And patients will tell you that, like a pins and needle sensation. No diabetes, no neurological condition, but it's just the effect of the cycle of existence. Neurasthenia, insomnia, that is very important for Avena sativa. You understand Avena is prepared from oats, so you won't have any adverse effects from it. If you see this triangle, hexagon, inability to keep calm, so tired and exhausted, cannot sleep. Working hours, 8 hours, 10 hours, I should sleep. I should be able to sleep, but I'm not being able to sleep. So I'm tired, I'm exhausted, cannot sleep. Especially for people who are working from home since, say March or Feb. Nervous headaches, you see neurasthenia workaholics, they have not lost their job, they're in their job, they're working, they're busy executives, and still they cannot sleep. And if you see the neurasthenia part, nerve tremors, so sometimes, they're getting fine tremors. That you may not get that very immediately, but as time progresses, as the months go by, gradually nerve tremors will come in. So in case of Alstonia, you have debility, low appetite post-COVID. In case of Avena sativa, you have debility, you have insomnia as a consequence of the stress, or you can come across cases where post-COVID there's a lot of weakness as well. So that's important to understand for Avena sativa. I want you to please try this medicine. 6C, 30C is useful. Even you can use this in tincture if it's available, depending on availability. But Avena hasn't disappointed me, especially in these months of March, April, May, June, and still continuing to July and August. And who knows, you may require it even for the next year or so. I'll take up questions in the end, so I will have time for questions, so don't worry about that. Another very fantastic medicine. I'll talk about polycress later on, but phosphoric acid is a fantastic medicine which you must, I repeat, must use this in this condition, in this situation. Think of people who are stuck in a foreign country. Think of people who are stuck in a foreign city, have not been able to return home still. And one of the key factors in those cases is homesickness. So away from home, away from family, away from people, from your near and dear ones, that takes the tolls on you. Phosphoric acid is your leading remedy for homesickness. Do remember Ignatia, phosphoric acid, and capsicum are your top 3 remedies from my understanding of the Materia Medica for homesickness. I repeat, Ignatia, capsicum, phosphoric acid. Now, when you put in perspective, those who have heard me before, those who were in the B.H.M seminar last year, I've always shared this with you. You put in perspective etiology on one hand, manifestation on the other hand. So when you put on etiology on one hand, here the etiology of phosphoric acid is homesickness, away from home. I'm talking about today's condition of, the world of the pandemic. Or think of someone who has encountered grief in terms of loss, death of a near one. But what I have come across in the previous 4, 5, 6 months is being away from home, stuck abroad, stuck in a foreign land, foreign city, and have not been able to return home, homesickness. Now you put the manifestation on the other hand. What are the manifestations? Remember, for phosphoric acid, it's an acid, so debility is the key word. I'll give you 6 debilities for phosphoric acid. The topmost is obviously mental debility. I'm sure you know this. Mental debility first, then physical debility of phosphoric acid. So mental debility. How will you understand mental debility? I'm away from home. I'm working, still away from home and working. I cannot focus. I cannot concentrate. I cannot motivate myself. Loss of focus, motivation, concentration. Nobody, again, my friends, you have to understand the practical implementation. No patient will come and tell you I am mentally debilitated, will they? But what you'll find is this: loss of focus, loss of motivation, loss of concentration. And that's the mental debility. Number two, you'll find physical debility of phosphoric acid. Physical energy is gradually getting low. And again, as this progresses over a period of time, the physical debility comes in. Thirdly, in phosphoric acid, you'll find gastric debility. Away from home, away from in a foreign city, foreign land, you're getting gastric weakness in terms of pyrosis, so water brush, heartburn, those kind of things, flatulence, sometimes even diarrhea. Fourthly, in phosphoric acid, you can get urinary debility. Again, that's not initially, but gradually as time progresses, urinary debility can come in terms of polyuria, frequent urination. Fifth, for phosphoric acid, you can get a cardiac debility, palpitations. Away from home, the homesickness, the grief of being away from a loved one, cardiac debility, palpitation. And lastly, my friend, ophthalmological debility, your vision is gradually starting to deteriorate. My friends, I've put here neurological debility, sexual debility. Again, that is not immediately you'll find in phosphoric acid. That takes time. But again, sexual debility can come in as time progresses. So put in perspective, homesickness, away from home for a long period of time. What is the reaction? Debility, mental debility. So loss of focus, motivation, concentration, apathy. I used to love listening to music. I've lost that interest. Indifference to those things that used to be of most interest to him. And that's phosphoric acid. Gastric debility, water brush, heartburn. These are the things which come on more quickly in phosphoric acid. Cardiac debility, more palpitation. Vision is gradually deteriorating, ophthalmological debility. And as I shared with you, urinary debility as well, polyuria. And in this period, with the homesickness, with the grief, diabetes mellitus has set in. Do always remember phosphoric acid is your go-to medicine, because in phosphoric acid, you have endocrinal debility as well. And that setting in of diabetes mellitus is a signal of endocrinological debility. So the grief of this pandemic, the grief of losing a near one, and you're coming down with diabetes mellitus, with the sexual weakness, with the physical weakness, with the polyuria, phosphoric acid is your number one remedy, my friends. I want to share this with you, a clinical tip for phosphoric acid. Do always remember, for phosphoric acid, the potency is very important. 18C, and I've used this very extensively with very good results. 18C has been suggested by Dr. Yunan. Yunan was a very famous homeopath in 1900s in Calcutta. And Dr. Yunan has mentioned about 18C of phosphoric acid with very, very effective results. So I want you to go ahead and try phosphoric acid 18C, which I'm sure you'll benefit from that. Sometimes 1X also helps for acute weakness and debility in phosphoric acid. So 18C, please do keep a note of that. You have to pre-order it from pharmacies, and I have used with very good results, and phosphoric acid really helps with 18C. So in the present condition, with the homesickness, I'm sure you'll find avenues for prescribing phosphoric acid. If you see the hexagon here on the top, mental debility followed by physical, apathy, indifferent, and the disorientation, confusion. I cannot concentrate myself and cannot comprehend clearly. Again, you won't find this developing, in 2 weeks or 3 weeks. Phosphoric acid pathology takes time to develop, maybe months, few months, and you'll find the difficult comprehension. You'll find the disorientation. What's your name? My name, it's like that. That kind of disorientation comes in phosphoric acid, irrespective of the age group. You see, I mentioned here hunts for words. That's quite classical for phosphoric acid. Another very useful medicine, my friends. I want you to try this not only for post-COVID debility, but even with COVID, if you're coming down with lots and lots of weakness, you're not being able to get a clear picture. Do remember Tinospora cordifolia. It's an Indian drug where you'll find fevers. You see, I mentioned slow fever worse in the morning, and it is known as the pick-me-up remedy when the patient has become extremely weak due to repeated attacks of viral and the exhaustion. So not only for post-COVID weakness, but even for weakness with the COVID symptoms. Say you have tried gelsemium with the debility, with the fever, gelsemium isn't working. You have tried cinchona with the fever and the debility, it's not working. Do put a note for Tinospora cordifolia. A lesser known remedy, but with very efficient results, especially in cases of debility with as well as post COVID. So those are more or less the remedies which we use for COVID and post-COVID debility. I want you to put another note and have a quick look in Borike for this wonderful medicine, Natrum Ars. Have a quick look in Borike, please, Natrum Ars. And, you know, these are the few medicines which have helped in the recent past with debility. I've used Alstonia, and I want you to understand the comparative Materia Medica so as to be able to differentiate. Alstonia, as I shared with you, is debility and low appetite post-fever. You may question in your mind, why not China? My friend, China has got profuse loss of vital fluid. So you had a COVID where there was a lot of diarrhea, there's a lot of vomiting. After that, there is weakness, you think of China, definitely. But whenever you come across cases where it's just a fever or they had fever or they had the viral symptoms, and post that there is debility and low appetite, do think of Alstonia. I shared with you Avena sativa post fever where there is weakness, insomnia as well. Insomnia is one of the key features in Avena sativa. I shared with you Tinospora where you have fever with debility or post fever debility, which is important, and a mild fever, you know, like a low grade fever, which you'll find in many cases of COVID. So that's important. And I want you to have a quick look in Natrum Ars, please. I'm just reading this in Borike from Natrum Ars. Introduction towards Zen facilitates the termination of the cold and conserves the strength and appetite. So very many cases, again, you know, where, you know, you have got over the flu, and not just for COVID, any viral flu, any flu-like symptoms, you've got over it. And after that, there's a lot of weakness and low appetite. Natrum Ars is really, really useful in 30C and 200C, where you understand you have the debility like arsenic, but it is specially adapted for post-flu debility and low appetite. You have many, many other medicines, but my friends, I've had good success with these medicines, and I want you to please try this. After the cold, there is a lot of weakness and low appetite. Sometimes you'll find good results with Natrum Ars. 30C and 200C is the potency for Natrum Ars. I'll come to stress. You know, whenever you think of the word stress, and if you think of today's 2020, people have been stressed in different ways. Think of a teenager who is not being able to go to school, stressed with that, is not happy with that. Think of an adult who has lost his job, is stressed with that. Think of a doctor who is physician who is handling COVID patients, or who is handling so much SARS patients is stressed with that. Think of people who are working as essential services, as cops in the police or in other government works. They're faced with something or not. And that stress is not only anxiety, but it can be a variety and spectrum of emotions which come together. And I'll share with you, my friends, few lesser knowns first, and then I'll go to the polycrest so as to handle that situation. Ambergris is one of the very first medicines which I want to share with you. A medicine which is, to be very honest, quite ignored. But I want you to understand ambergris because think of someone who has lost their job and depressed as a consequence of that. So he's losing the desire to live on one hand. At the same time, you're finding that person gradually losing his comprehending intellectual skills. Cognitive skills are gradually getting poor. My friends, ambergris is a combination of natrum mur and phosphoric acid. So whenever you have the grief of a loss of a person, you have the grief of loss of a job, and along with that, your intellectual cognitive skills are getting affected, like phosphoric acid. You think of ambergris. So why natmu? You're retaining your emotions. You're not expressing it. You're keeping it inside. And that retention takes a toll on you intellectually. That retention takes a toll on your cognitive skills. You start to develop poor comprehension, poor understanding. It's like signs of early senility is setting in, and that's important for ambergris. So a lot of weakness and debility with the retention of natmu where you're not expressing it, at the same time, the poor intellectual faculties of phosphoric acid, and that combines ambergris. So whenever you're confused that should I go for a phosphoric acid, his memory, his comprehension is poor, there is a bit of indifference. But at the same time, you won't expect a phosphoric acid to be retaining his emotions because indifference doesn't cause retention of emotions. But here you have an individual where you have indifference, but at the same time, there is retention of emotions as well in terms of I'm not being able to express my frustration to my family. I've lost my job, or, I'm having a lot of stress at the workplace because people are losing their jobs around me. And that takes a toll on you. And that's important for ambergris. 30C, 200C is good choice of potency for ambra. One of my top medicines, my friends, I've used in the last 3-4 months with very efficient results. And I want you to really understand and prescribe this medicine. Looking at the news, today it's 60,000 cases. Thug, 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 palpitation. Looking at the news, 800 people died today. Thug, 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 palpitation. You heard someone in the next neighborhood died of COVID. Thug, 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 thug. You are having palpitation. You cannot sleep at night. So a lot of anxieties, insomnia, palpitations, as a consequence of the fear and anxieties with this pandemic. And scutellaria, my friends, is a wonderful medicine. You'll find people resorting to conventional psychiatric anxiety remedies, throw those out of the window, prescribe them scutellaria. If you see all the points I've mentioned here, nervous sedative, so you cannot sleep at night, I'm having palpitation. Cardiac nervousness, what do you mean by cardiac nervousness? I'm having palpitation. Even like a weakness after flu. So you can have the debility to a certain extent as well, but not to that extent of Alstonia or Avena. Night terrors, I cannot sleep at night. I'm having panic attacks. So the anxiety, the fear, resulting in insomnia, resulting in palpitation, resulting in night terrors, resulting in polyuria, frequent urination. So stressed out, so anxious, watching the news every day, watching the count, the fatal count, the total cases count go up, I'm having polyuria. Severe headache with anxiety and stress, fear. You have to understand for scutellaria, the key word here is fear and anxiety. Resulting in insomnia, resulting in palpitation, resulting in night terrors, resulting in polyuria, resulting in severe headache. And lastly, sometimes you can get involuntary seminal emissions as a result of this fear and anxiety. My friends, I want you to please try scutellaria. How to differentiate from aconite? You understand aconite is also a remedy for fears and anxieties, for this kind of panic. But you have to understand in aconite, one of the major theme of aconite is the fear of death. But here, in case of scutellaria, the fear of death is not there. But it's just the fear and anxiety of listening people around me getting affected, listening, seeing people dying or hearing those news, and that affects me, and that's scutellaria. How are you affected? You're getting an insomnia, you're getting palpitation, you're getting polyuria, you're getting a severe headache. 6C, 12C, 30C, whatever potency is available, my friends, I want you to try scutellaria. Believe me, you won't be disappointed. Open Boricae, if you have your Boricae with you, have a quick look in Boricae for scutellaria. And I want you to understand this remedy so that you can prescribe. Very many people have asked me this question in the past, why not aconite? Again, as I shared with you, in case of aconite, you'll find that restlessness is there. You'll find that anguish, that fear of death is very prominent, which you won't find at all in case of scutellaria. So whenever you come across fear of death, you have the mental restlessness is going up and down. What's going to happen? What's going to happen? That's more aconite. But whenever it's, watching today, 800 people died. Somebody next door had COVID. I can't sleep. I'm having frequent urination. I'm having a severe explosive headache. Go for scutellaria. If you see in the introduction, scutellaria is a nervous sedative when nervous fear predominates. Cardiac irritability. What does cardiac irritability mean? Cardiac irritability is the palpitation. If you look in the head section, night terrors, explosive headaches with frequent urination. There's that headache with polyuria, similar to gelsemium to a certain extent. If you look in the male section, seminal emission and impotency with fear of never getting better. You see how a small remedy, but it's so valid in today's conditions. You understand sexual weakness has a lot to do with your emotional frame of mind. And you'll come across people in these few months where they have shared with you, I'm encountering sexual debility, I'm encountering sexual weakness because of the stress, because of the anxieties of what is going around me. If you look in the sleep section, night terrors, sleeplessness, frightful dreams, waking up with panic attacks, and that's scutellaria. My friends, please do prescribe scutellaria and you won't be disappointed. 6, 30, 12C, even 200C if you come across scutellaria will help you. And especially again, you know, my friends, those again who have heard me earlier, I'm sure you have heard me say this, that we all, every one of us, each one of us, those who are joining in, are always skeptical, are always cautious, to be is the correct word, before prescribing a new remedy. We all have a comfort group of remedies which you always want to use. And as I shared with you earlier as well, the only way to implement new remedies in your practice is by comparative Materia Medica with those remedies which you use often. I'm sure you have been using aconite day in, day out for anxieties and panic attacks. But in many of those aconite cases, I'm sure you'll come across the patients would have told you I'm having palpitation. Patients would have told you I'm having sexual weakness. I'm having night terrors. I do not have fear of death, but it's just the surroundings and situation around me which is taking a toll on me, and that is scutellaria, my friends. So I want you to please use scutellaria for today's modern day world. Another fantastic medicine which I want you to understand. If you think of the anxieties, the frights and the anxieties of this present day world, as I shared with you, from age 8 to 80, no one is free of that anxiety and fear. Especially think of those geriatric 60 up people who have comorbidities, which is so common across the world, of diabetes, or they're hypertensive, or they have had a history of asthma in the past. So they're constantly living in the fear and fright. And there's always that anticipation. What if I get that infection? And more than getting the disease, it's the mental health which is totally destroyed in these past months. There have been, every government across the globe have issued advisories for people above 60 and 65 to not venture out. That takes a toll. You know you are susceptible. You know you are vulnerable. So that anticipation of getting the disease, that apprehension of getting the disease. And whenever you think of a very deep acting nosode like dysentery compound, remember 3 areas, 3 organs which affect, or 3 sphere of actions for dysentery compound. It affects you in the heart, so you can get palpitation, you can get an oppression, a chest pain, either of these. It affects you in the stomach, you're having loose stool, your consistency of stool has changed, features like irritable bowel syndrome. And it affects you in the nerves, so you're getting twitching in the muscles, chorea, or you're getting a fine tremor. So if you see the top hexagon, nervous tension of anticipatory type. So you're anticipating, and especially I found this very applicable in people post 50 who have comorbidities, who have come down with conditions like diabetes or COPD, and they feel they're vulnerable, they're susceptible, and they're anticipating perhaps the worst. Palpitation, chest pain as a consequence of that, a gastric pain, or loose stool as a consequence of that, or you're getting nervous tremors or twitches as a consequence of that. So think of cases where you have given argentum nitricum, not working, try dysentery compound. Think of cases where you have given arsenicum album, not working, try dysentery compound. You know, it's a bowel nosode, and dysentery compound is a combination of arginate, arsenicum. And when those big, important polycrests haven't worked for this kind of conditions, dysentery compound will come in handy, my friends. So please do try dysentery compound in this condition. If you see here, anticipatory nervous tension is the keynote. As I shared with you, argentum nitricum, arsenicum album haven't helped you, think of dysentery. How it affects, you see the heart nosode. So as I shared with you, the palpitation, the nerve, the oppression, angina. As I shared with you, the chorea, the neurological tweaks, tremors, and the gastralgia. So like like an anticipatory gastric pain, and that is applicable in dysentery compound as well. Please do not miss out in this condition. I'm sure you come across people with this kind of anxieties, but here you have to understand the key word is anticipation. That's why people who are the most vulnerable are anticipating it the most, and hence dysentery compound will come to your rescue. 200C 1M, a good choice of potency. Sometimes a single dose will help you in soothing the frayed nerves, and that's important for dysentery compound. And the last one in this list, my friends, is Phos. As I always share with you, I do not use repertory. So I cannot tell you of rubrics and sub-rubrics, but I know my Materia Medica. And whenever you try and differentiate between Phos and Avena sativa, as I shared with you earlier, Avena sativa, think of Mr. Avena, Mr. Phos, both are working long hours. At the end of the day, Avena sativa will tell you, I'm so bloody tired, I'm so exhausted, but I cannot sleep. That's Avena. Tired and exhausted, but yet cannot sleep. That's Avena. But what Mr. Phos will tell you, I'm working for long hours, but at the end of the day, I cannot sleep as well. Next morning, when I'm trying to concentrate, some deadline which I would have finished in 2 hours, that's taking me 4 or 5 hours. That's taking me 6 hours. People are doing all sorts of video calls, keeping up with friends, meeting friends. I do not like to do that. It's better I stay on my own. Think of a 17-year-old, 18-year-old preparing for his entrance exams, working long hours, still cannot sleep, Avena. But working for long hours, few days, few weeks later, they'll tell you, I could have remembered this subject in 30 minutes or 40 minutes. It could have registered. But now it's taking me 2 hours. Now it's taking me 3 hours. Why? My friends, if you open Borica's Materia Medica or you look in any Materia Medica, you'll find it's mentioned, slightest labor seems a heavy task. So what kind of labor? Mental labor. It's taking a toll on me. It's taking a heavy task. So whenever you come down with weakness and neurasthenia, post working long hours, especially in this kind of situation where you are stuck, that's Avena. But whenever you are not only getting low sleep, but at the same time, you feel, I cannot concentrate like I used to. I cannot retain that information like I used to. You're gradually going to a Phos state. If you open Borica in Phos, you'll find it's mentioned in italics, mind section. Slightest labor seems a heavy task. Disinclined to converse. So you'll find a very bubbly extrovert phosphorus turning into Phos due to the social distancing, because he doesn't like to meet anyone. Indisposed. There's a line, indisposition to meet people. And that's Phos again. So my friends, whenever you come across people who haven't lost their job, who are working equally, if not even more, and they're coming down with a lot of debility, neurasthenia, it's more Avena. But if they're coming down with weakness, but at the same time, intellectual functionings are getting affected. And that's the exact expression patients will tell you, that whatever I could have done in an hour's time, that's taking me 3 hours. And that's your Phos state. Slightest labor seems a heavy task. I'm sure you're prescribing 6X to everyone for Phos, but my friends, I've got very good results with 200C and 1M. So Phos, make sure, if you feel it's a Phos totality, make sure you prescribe 200C and 1M. You won't be disappointed. So my friends, with anxiety, I want you to please try out this medicine. Try Scutellaria, that's my number one. With that kind of panic attacks, with that kind of anxiety, the palpitation, frequent urination, that's Scutellaria. I want you to try dysentery compound, heart, nerves, and stomach, where the keynote is anticipation. Remember, the vulnerable are anticipating it the most. I shared with you Phos, remember, poor comprehension on one hand, insomnia on the other hand, and indisposition to meet people on the other hand. They don't want to meet people. So that's about Phos. And I'm sure you'll be benefited with these remedies in the future. Give me a moment. I shared with you stress. I'll be sharing with you a few lesser knowns for depression, and then we'll go to the polycrest. I'm sharing with you the most important ones, my friend, in today's world. I'm sure many of you know about alfalfa as a very useful medicine for low appetite in children. But in today's 21st century, in today's pandemic year, think of an adult who doesn't want to eat. Think of an adult who doesn't want to have the regular meals, lunch, dinner, breakfast. He's nibbling on sweets. So he's sitting in front of the TV, gorging on sweets and ice cream. That's the only thing that makes him happy. And at the same time, he feels gloomy. He feels everything is dark and black. And that's alfalfa. So even in today's world, I want you to open Borica and have a look in the mind section, please. Losing the appetite in terms of for regular meals. You don't want to have a lunch or a dinner. You're gorging on sweets and chocolates. And at the same time, you're feeling very low. You feel the world around you is turning blue and black. If you open Borica, if you look in the mind section, you'll see it induces a general feeling of well-being, clear and bright, so that all blues are dissipated. Blues is the depression. And my friends, alfalfa will help you in this condition where you feel low. You feel appetite has gone haywire. You're having nibbling and sweets and chocolates. At the same time, you're gloomy and drowsy as well. My friends, alfalfa has benefited in these conditions with very effective results. 6C, 30C, even 200C is applicable for alfalfa. And especially, I've used this in the present situation as well. I'd like to share with you another very important medicine, my friends, in today's world. And believe me, we have done thousands and thousands of cases, not only during COVID, but even before that, in a case where the patient is dependent on antidepressants. So whenever you come across cases where there is nervous depression, you feel low, you feel the entire world around you is turning black, and patient is requiring immediate help to counteract that situation where they're on antidepressants. My friends, verbena is your remedy to help in cases to wean off patients of conventional antidepressants. You understand, whenever you prescribe a deep-acting polycrest like a Natrum Mur or an Aura metallicum, in a case of clinical depression, it will take time to start working. But very many cases you will find where the patient is on antidepressants and is gradually increasing the dose as the day progresses. Verbena can help you in those cases with very, very good results. You know, you have to understand these are small, lesser known organopathics. Why I say organopathics, which have got specific affinity for different conditions. Herring always mentions this, that for a totality to be complete, you need 3 symptoms. Like for a stool or a chair to stand, you need at least 3 legs for a chair to stand. A chair cannot stand on 3 legs. A chair cannot stand on 2 legs. A chair needs at least 3 legs for the chair to stand properly. Similarly, for a homeopathic totality to be complete, you need at least 3 symptoms. And here you see I mentioned for verbena, it's very small remedy. But believe me, I'm sharing with you because we have had very good results, and you'll find it very effective in cases where the patient is dependent on conventional antidepressants. You see the key word, it brightens up the patient's mental powers. They feel so dark, they feel so low that whenever you prescribe verbena, it will brighten you up. Insomnia can be there. Sometimes neurological diseases like epilepsy can be there as well in case of verbena. Tincture, again, 6C and 30C are good choice of potency for verbena. And the very useful medicine. These are, you know, if you want to try just few medicines from these organopathics, I want you to try these 2, Tinospora and verbena. Tinospora, you understand the apathy of living that constant daily circle of life. Half dead, half alive feeling. That apathy, you know, that day in, day out. You're feeling, you know, it's the same life. Again, Sunday comes, Monday starts. You feel it's the same circle of existence. I'm just following the routine. So it's like an apathy which has set in. So it's more than the depression. It's like a clinical apathy where you feel half dead, half alive. Mental fatigue. And that's Tinospora. Very many cases where I have tried phosphoric acid, that didn't help me. I've tried Tinospora with very good results. Again, 30C, 6C, 12C will help you in Tinospora. It's that kind of a feeling. You understand that it's like your soul is half dead. So half dead, half alive feeling is important for Tinospora. So verbena, Tinospora, these are your top remedies, top organopathics, my friends, which I want you to please use. I want you to, if you make a top 5 of organopathics for emotional conditions, which I shared with you, my number 1 in this list is Avena sativa, because you understand not only it helps conditions post-COVID, the debility, but even in cases where people are stuck in their homes and they're coming down with neurasthenia and insomnia. Number 2, looking at the television, looking at the social media, you're coming down with stress and anxiety and palpitation. Do remember Scutellaria. So my number 2 is Scutellaria. Number 3, verbena, you feel everything is dark around you, clinical depression. It brightens up the patient's mental powers, especially, as I repeat, when the patient is dependent on antidepressants. Patient is feeling low, you cannot go ahead and prescribe an aurum metallicum. Can you? You need a broader totality for prescribing an aurum metallicum. Patient is feeling low, you cannot go ahead and prescribe a causticum. You have to respect the polycrest. Whenever you're prescribing the organopathics for depression and you gradually wean off the patient's antidepressants, you'll be getting a clearer picture later on for a polycrest prescription. Those who were with me in the B.H.M.S seminar last year have heard about me, how we prescribe organopathics, and always in a case of drug-dependent cases where you have a very contaminated picture. Natural disease is superimposed by an artificial chronic disease. You start off with an organopathic. Very many cases, when you get a clearer picture, you go off to prescribing a polycrest. So I shared with you Avena, I shared with you Scutellaria, I shared with you verbena. Number 4, Tinospora, half dead, half alive feeling. You know, it's the apathy in this condition, which is important for Tinospora. Again, 6C, 30C, 200C is very useful for Avena sativa, is useful for Avena, is useful for Tinospora as well. And lastly, I'm sure you're using Phos, but I will share with you number 5 is Phos. With the insomnia, with the poor comprehension and understanding, Phos, I'm sure will help you. And to a certain extent, if you think of a very extroverted, bubbly phosphorus, gradually shelling himself down, gradually withdrawing himself, indisposed to meet people, that's when Phos comes in as well. So these are my few medicines for depression. I'll share with you my top polycrest, my friends, which you'll find useful in this condition. Obviously, there are a lot of polycrests I'm sure you have been using for post-COVID stress. And whenever I'm using the word stress, it implies a spectrum of emotions. It could be fear and fright. It could be grief. It could be a humiliation in terms of losing work. It can be just the stress and anxieties and the physical weakness which you're encountering day in, day out. I'll be sharing with you a few of my top remedies. As you understand, the time is limited. I'll be sharing with you a few of the topmost remedies which I use. My friends, if you haven't used this medicine, I'd like to share with you about Calcutta. Think of someone who's working as a physician in the frontline, health worker, who are working in the hospitals, who are working day in, day out, some of your friends, some of your colleagues. So they're very diligent. They are very dutiful. They are very moralistic and routinistic, with a strong sense of responsibility, strong sense of duty, which you find with Kailis. And when these Kailis, say who are working in the ICUs, who are working as hospital staff, they're seeing death and devastation in front of them worldwide, anywhere in the world. But still, they have nerves of steel and they're going on working with their duties. But when they come home, when they are in the comfort of their bed, they're trying to get some sleep, they remember those images, those gruesome images of people fighting for their lives, for the last breath of air which they can get, fighting for their life and death. Those images of people losing their loved ones. People who are working as essential workers in the pandemic world, who have that strong sense of morality, strong sense of duty, strong sense of traditions. But yet, when they come home, they see those images flashing in front of their minds, their eyes, and they wake up with panic attacks. I know a few of my colleagues who are working as healthcare, as like frontline healthcare workers who I have prescribed Calcutta, because they're coming down with panic attacks and nightmares, which are so characteristic of arsenic. So you see how the effects of seeing death, devastation, the effects of seeing people dying in front of you, the effects of people fighting for their last breath, that takes a toll even if you have nerves of steel. And at the end of the day, you come down with panic attacks, you come down with anxieties, which are so characteristic of arsenic. And that's when you think of prescribing a Kali arsenicosum. You see, I've mentioned panic attacks, stress aggravates, restless. Why? These are all features of arsenic. By the same time, very moralistic, very conservative. Those are Kali features. And two things you'll find with KLERs in today's world, they have a strong desire for company. They will tell you, whenever I'm with people, I feel so much better. You'll understand that's a feature of arsenic. So why not arsenic? Why KLERs? Because you have to understand their basic nature is a Kali nature. And when they encounter these events, that's when the arsenic imposes on them and they gradually converge into KLERs. The stress, the restlessness, the panic attacks, the desire for company of arsenic. But at the same time, they're very dutiful, very moralistic. They'll go back to those jobs. They won't quit because they know the world needs them. With a strong fear of heart disease. And that's your KLERs. Remember, KLERs is your leading remedy for fear of heart disease. Any repertory you open up, you'll find KLERs mentioned in the top grade, fear of heart disease. 200C and 1M are your choice of potency for KLER senicosum. We come to Calcutta carb. I'm sure you know calcarb and you'll be wondering that why, I'm sharing with you calcarb, because everyone knows it apparently. But if you think in today's world, think of the oyster, which always has a shell above and a shell below to protect it. You understand the oyster only comes out for feeding and reproduction. So otherwise it always stays inside other than, for food or to reproduce. So it's always in a close protected environment. Think of a student, a 17, 16-year-old who is used to going to schools, or even a 10-year-old, 12-year-old who is used to going to school, who is used to meeting his friends, has suddenly lost that familiar environment, studying from home. Think of that 28-year-old who is used to going to his workplace, meeting friends, suddenly working from home, has lost that familiar environment. Think of the middle-aged woman who is used to going out to the market, who is used to meeting people, suddenly seeing everyone wearing masks, and who is suddenly seeing people are practicing social distancing and other behaviors. They're losing their known environment. My friends, one of the very important etiologies for Calcarea carb is fear of losing familiar ground. You have lost a familiar environment. The world around you has changed. Doesn't matter for the good or worse, but you don't find it familiar. You have lost your familiar environment. And whenever you have lost your known environment, whenever you have lost a familiar environment, you feel insecure. This is not my world, which I know. This is not the people which I know. I become insecure. And how does that insecurity gradually manifest? Remember the 3 A's for Calcarea carb: anxiety, alertness, apprehension. I start to become anxious. I start to become apprehensive, alert. So whenever you hear people telling you, I'm feeling insecure due to this new environment, I feel I have lost the familiarity in the world around me. Everything seems new. That's the insecurity. And that's when I'm feeling fearful. And that's when I'm feeling anxious. That's when I'm feeling worried. And even if you don't have physical features, based on the etiology on one hand and the manifestation on the other hand, you can always think of Calcarea carb. Do remember this, my friends: fear of loss of familiar ground. And that's the etiology. And that's the insecurity of Calcarea, which is resulting in these symptoms to develop: anxiety, alertness, apprehension. and they become totally fearful. Farrington mentions this in his clinical Materia Medica. If you come across someone who tells you, I fear everything, remember it's Calcutta cow. Calcutta is a person who will tell you, I fear of everything. You name a fear, I have it. And that's Calcutta. So you understand how the thought process progresses. It starts off with losing familiarity. It starts off with feeling new, everything in a negative way, resulting in insecurities, resulting in the 3 A's, anxiety, alertness, apprehension. And that's very, very classical for Calcutta. Potency, obviously, you can use higher potencies, 200C and 1M, which is very useful for Calcutta cow. Another very important medicine, which I feel is very much needed in today's pandemic world. You think of people who are working in front of the computer for long hours and hours and hours, work from home. They will tell you, if you look at me, please, that there is a pain in the nape of the neck and this region, so the shoulders, neck, and this region is really paining. Maybe because of typing, but it's just that neck pain due to the stress, which is in this region. And with this neck pain, you feel everything is going dark. You feel very depressed. You feel very low. If you understand semicifuga, the common name of semicifuga is black cohosh. And if you look in Allen's keynotes later on, you'll find it's mentioned sensation as if black cloud enveloped all over her. So it's that kind of clinical depression where you feel everything is dark and black around you. And resulting from that, you have this neck pain, shoulder pain. Could be due to typing for long hours, could be due to the depressed state as well. And that's very important for semicifuga in today's world. 200C and 1M is your choice of potency for semicifuga. I'd like to share with you my last medicine for today, perhaps. I'll see if I can do some more. I'll be taking up questions after this. Carcinosin. Again, maybe not today, maybe not in the next month, you'll need carcinosin. But as you stretch people, you stretch the pandemic, the pandemic gets continued up to the next year, you'll find people's emotional tolerance getting stretched. People becoming more and more emotionally vulnerable. Think of that 30-year-old who is working in the airline industry. Constantly living in the fear and fright. What if I lose my job? Constantly in a pressure to perform. Think of that 60-year-old, again with comorbidities, who is constantly living in that anticipation and apprehension. What if I do not survive this pandemic? What if I die? What if I do not outlive it? Think of that 40-year-old manager who is working in the restaurant. And there's that constant pressure to perform because I may lose that job. You understand, hospitality industry is the worst affected. Constantly living in that fear and fright. What if I lose my job? Constantly living in that anticipation and apprehension. What if I am sacked? Think of that young, bubbly teenager who's so accustomed to partying and meeting with friends. Her only source of enjoyment is communication. And now you have been told off to cut off communication. It's all right for weeks. You can make yourself understand. It's all right for months. But when it continues for a year or more than that, there's a prolonged state of unhappiness which comes in. Or think of that woman, a middle-aged woman who has lost her husband to COVID, who could not survive it, living in that unhappiness, living with a suppressed anger, probably with herself, that couldn't have done more for him. A suppressed anger for the healthcare system that, they have saved him. And you see these spectrum of emotions, whenever you join the threads together, is what forms carcinosin. A prolonged history of fear and fright. A prolonged history of anticipation and apprehension. A prolonged history of unhappiness. Prolonged history of suppressed anger. And a prolonged history of pressure to perform. I gave you numerous examples to make you understand carcinosin's etiologies. And as I shared with you, in a week or in a month's time, you won't find carcinosin to develop. But as I shared with you, as we stretch it longer, as people's emotional walls start crumbling, as they become more and more emotionally vulnerable, you'll find them gradually developing carcinosin pictures. My granddad used to always say 12 to 18 months is a period for carcinosin's etiologies to develop. So we are already into 6 months, and you wait for another 6 months, you'll find carcinosin pictures to gradually come out. How will you manifest carcinosin? Remember, carcinosin is your topmost remedy, which has all the miasms in equal degree. You have an empty feeling as a consequence of that unhappiness. You feel hollow inside, an emptiness, hollow, empty, lack, sora. You start washing and repeating. You're becoming a cleanliness freak. You're cleaning and cleaning. You're washing your hands. You have torn off your skin. Excess, psychotic, perfection turning into an obsession. Remember, carcinosin is a perfectionist like your phosphorus, naxvomica, arsenicum. But whenever perfection borderlines or perfection gradually is stretching into an obsession, that's when carcinosin joins in. Trying to make everything free of infection, trying to make everything free of the virus, washing things, washing utensils, you're bordering on obsession, psychosis joins in. That's a psychotic carcinosin. Due to that pressure to perform at work, due to that constant fear and fright of losing the job, you're becoming destructive, you're becoming aggressive, you're hitting out on your children. Moms are coming and tell you, his dad never used to, put hands or hit the child or, shout on them. But now they're doing aggressive behavior. That's a syphilitic carcinosin. And sometimes you'll come across carcinosin where you are having tremendous mood swings. Changeability, that's a tubercular carcinosin. It's an empty feeling with a lot of anxieties, that's soric carcinosin. An obsessive carcinosin where the perfectionism of carcinosin has gone and now they are into obsession. That's a psychotic carcinosin. Checking and rechecking. Is that surface clean? Is my hands clean? Is my children clean? Obsession, carcinosin. Becoming aggressive, becoming destructive, throwing things, taking your frustration out on your family. A syphilitic carcinosin. And changeability, mood swings, where you have a tubercular carcinosin. With all these etiologies, And my friends, you have to understand all these spectrum of emotions come together in building a carcinosin's picture. You have to understand carcinosin's nature is very soft, very sentimental, sympathetic. They love rhythm, they like meeting people. But whenever you come across these life-changing etiologies over a prolonged period of time, by a prolonged period, I did not say a week or a month. My understanding, what I've learned, it's not mentioned, but I've been told this as an ancestral tip, 12 to 18 months is a minimum period of time for carcinosin's pathology to develop. And I'm sure as time progresses, you'll find carcinosin's emotional essence to come up gradually. And I'm sure you're coming across cases where people are becoming more obsessive. They're washing things, they're cleaning things. You're handling those cases with phosphorus. You're handling those cases with arsenicum. But I'm sure as time progresses, you understand the exciting cause is not going away. You're seeing that constantly on TV. You're being told constantly on social media to do these things. So the exciting cause is persistently there. And how can you remove the effects if the exciting cause continues to persist? So even though arsenicum is helping to a lot of extent, your phosphorus, your noxomica is helping with the fastidiousness, but you have to appreciate and understand that when that fastidiousness is bordering on obsession, those remedies perhaps are not helping you as they should, and you need a deep-acting nosode like arsinosin. Similarly, for the pressure to perform, for the constant anticipation and apprehension, you're finding results with arginate. Arginatum nitricum is helping with you, say for a psychic diarrhea or with the tremors. But again, with the anxiety being more prominent, with the empty feeling being more prominent, sometimes arginatum nitricum isn't finishing the case. You understand, because you sometimes require a deeper acting remedy like arsinosin to finish it up. And similarly, another remedy which you'll use quite often in this situation is nitric acid as well, because you understand somebody who is looking after the entire family, everyone is at home, the wife or the parent, is looking after everyone. So that constant overwork takes a toll on them. They become irritable, they become abusive, they start to accuse. Nitric acid will come in. But again, when that accusations, when that irritability borderlines on aggression, that's when the nitric acid stage is gone and perhaps you need a carcinosin. So you have to understand these remedies will definitely come to your help with these conditions. Obviously, you understand this is not a limited topic. There can be very many variations. I've shared with you. It's my honest sharing with you the remedies which I found. That's why you found me skipping some of the remedies, because I find these the commonest ones to share with you in this limited span of time. And I'm sure you'll find good results with these remedies, because you understand the mental effects of the pandemic won't be showing up on any index, not be showing up on any blood test. But homeopaths around the globe will appreciate, acknowledge, and understand that the world itself has changed and some people will be suffering as a consequence of that change. And it's for us to help as much as we can so that they do not go into the shackles of conventional anti-anxiety or antidepressants. Because once you're under those remedies, medicines, it's very difficult to withdraw yourself from that. Thank you very much for your kind attention. If you have any questions, do type in and
yeah. Actually, I have received so many questions, but I request all the delegates to ask the relevant questions to the topic.
If you can type in, and I can have a look and
yeah. Dear participants, I have enabled the chat. Please don't message me privately. Please put the message in the everyone session so that sir can answer. Okay, we can have, sir, how many times we have? 10 or 10 minutes?
Yeah, we'll take up 10 minutes.
Okay, so we are taking up 10 minutes. Participants, please ask the relevant doubts, okay? Or should I help you, sir?
Yeah, please.
What is the difference between carcinosin and sepia?
Good question. Sepia, due to this kind of situation I'm sharing with you in in this situation. In case of sepia, you'll find they're more detached, more disconnected. So it's more indifference. Indifference miasmatically is more tubercular. So you'll find more indifference in case of sepia, gradually going on to irritability. But in case of sepia, it's more the stasis which affects people. So, you know, that same cycle of existence, same circle of existence is what affects in sepia. So that's the etiology resulting in indifference and irritability. But as I shared with you in carcinosin, it's more a broader picture, which is important.
Okay. What is the cause of indifference in fluoric acid men?
It's not related with this topic, to be very honest. Fluoric
Yes,
acid indifference is more related with sexual factors. So, you know, I will ignore that, that part.
Okay, fine.
Please ask questions relevant to today's discussion, please. Thank you.
What will be the most suitable indicated medicine for nervous cough with the anticipation of pandemic?
Very good question. Nervous cough with anticipation of pandemic. I'm sure people have come across with that, you know, they feel like, you know, I'm getting a cough, probably it's not flu or anything like that. Do remember ambergris and phosphorus are your top two remedies for a nervous cough. Ambergris and phosphorus.
Any particular medicine for the financial stress and loss of money, including debts leading to physical complaints?
Good question again. Financial stress or loss of money. Again, those remedies which have an etiology from anxiety and anticipation, those can help you. But I found good results as well with Bryonia. Bryonia is a medicine which has strong fear of poverty. So if you have other symptoms which point towards Bryonia with a strong fear of poverty, you remember that. Also Calcarea fluid, where they have a strong fear of financial loss. So that's important as well. Those can help you in that condition. Sometimes you'll come across cases, especially in the last few months, where people in important positions have lost their jobs. And sometimes they feel really humiliated as a consequence of that. And in those cases, Kelly-Brome can help in those conditions where the etiology is from business embarrassment.
Okay, sir. Sir, what are the differentiation points between Phos and phosphoric acid?
Good question. I shared with you earlier on as well. Phos, where you have three areas. A, you have sleep to be affected, which is not affected in phosphoric acid. You have poor comprehension to a certain extent that can be affected in phosphoric acid. And thirdly, you have indisposition to meet people, which can be to a certain extent in phosphoric acid as well. But what differentiates in Phos and phosphoric acid, A, you have insomnia in Phos, but you have tremendous debility in phosphoric acid, which is the point of differentiation.
Medicine for exams postponed and later developed anxiety and sleeplessness due to loss of academic year.
This is a very common problem, as I have shared with you earlier on as well. People whose exams are postponed, they have studied for quite a long period of time, and now they're losing focus and motivation and concentration as well. Phosphoric acid is helping in many of those cases. I've had good results with anacardium as well, where they feel frustrated, where they're feeling more accusive and abusive as well. Anacardium has helped, but phosphoric acid has helped in most of these cases, to be very honest, where there's loss of focus, concentration, they feel like an apathetic situation.
So many people have asked regarding the...
Sorry, I missed that.
Hello, sir.
I missed it, sorry.
I have a call in between.
Yeah, I can hear you.
Many people have asked regarding the repetition of medicines while we are using in organopathy remedy doses.
I'll give short understanding of that. Any organopathic which you're using is for the acute symptoms. So say for the depression, you're using verbena. So you can use in tincture. If you're using tincture, 10 drops, 8 hourly, stop when the patient improves. So, you know, it's like when the patient needs antidepressants, you ask them not to take it, you ask them to take the verbena instead. You cannot sleep, you ask them to take Avena, say 10 drops, 8 hourly, stop when the patient improves. If you are using in tincture, if you're using 6C, 2 to 3 globules, Again, 8 hourly, you use it as and when required, stop when improvement ensues. So it all depends on when the acute symptoms subside.
Sir, many people, I don't know why these questions are keep coming up. Many have asked regarding this prophylaxis and pandemic repetition like that. Should I omit the questions?
I'll just talk about that.
Arsenic album,
yeah,
like that.
I saw that.
Camp,
To be very
like
honest, my friends, genus epidemicus can only be discovered after it has been administered on several patients across age groups, but which hasn't been done, to be very honest. I do not myself vouch for Arsenicum album because it is not a genus epidemicus. You understand, if you have read organon sections about genus epidemicus, or like for the epidemic, only it can be understood after it has been administered on patients, whatever medicine is helping. So I cannot share with you any particular medicine which is effective as a genus epidemicus. I'll be just giving you a vague understanding, and I don't want you to encounter failures on the basis of that. Look at your area, look at your neighborhood, what kind of patients coming up, because you understand it's different strains. And very many people in Europe, it's more like a dry cough, hacking cough is coming up. In some part of the world, it's more like a diarrheic stool is coming up. So it's different symptoms in your part of the world. So judge on what is the symptom in your neighborhood, whatever you're prescribing, what is giving you good results, and you frame your genus epidemicus according to your condition. It's very unfortunate that we haven't been able to come up with the genus epidemicus, because there is no world body to govern that. So again, I leave it up to you to decide. I cannot, it's wrong of me to give you a particular remedy and say, give Briania to everyone or say give arsenic to everyone, because I myself don't know if it's that working or not. So I won't give you that wrongful advice.
Yeah, it's a very good advice, sir. I think people can decide the doses according to them. Then another question, sir. For children stuck at home for 6 months, especially those living in flats with hyperactivity, what can be the medicine?
That's a good question. Children are always needing communication, as I shared with you. They always like to meet people. They always like to go out, have friends, and they're becoming more and more restless. I've had good results with a remedy called Centris, C-E-N-C-H-R-I-S. Centris is a remedy which is a combination of arsenic and lachesis. So you have a lot of restless like arsenic. At the same time, they're very, very talkative like lachesis. So whenever you have a combination of arsenic and lachesis in terms of restlessness and loquaciousness, do think, especially for acute hyperactivity, you can use Centris. But my friends, any polycrest can help you, which is a constitutional for the child in that condition. But if you are not clear with that, Centris, I repeat again, C-E-N-C-H-R-I-S for that kind of a condition to help you. Also, I've had good results with phosphorus as well, because you understand active extrovert children who are stuck at home becoming more restless, phosphorus can be very restless as well. That can help in those conditions as well.
Many people have asked regarding the physical weakness like that, this COVID time like that.
I shared with you a few remedies for physical weakness: Alstonia, Natrum Ars, Avena sativa. All these are remedies. Cinchona, Gelsemium. I'm sure you know Cinchona and Gelsemium, but try Alstonia, try Natrum Ars, try Avena sativa, especially for post-flu debility, post-COVID debility.
Okay, sir. I think the time is 12:05. Should we stop or what to do?
We can take 3 more.
Okay, sir. For ladies stuck at home, between job and household with increased irritability.
2 remedies will come up in that condition. One is stasis, because you feel you're stuck in your homes, you cannot go out, you cannot have a life you used to. So with children, with husband, everyone is stuck at home. More work, CPR will come in. And secondly, if you're coming across with a lot of debility, with a lot of backache, and you're really in need of communication, Helonius will come in as well. So Helonius and CPR are those 2 remedies in those conditions.
Fear of COVID, if go out, so remains in home.
Again, all the anxiety remedies I shared, those will come in, and like the arsenicum, obviously, argentum nitricum, but dysentery compound, I've had good results with that. You know, the constant apprehension, what if I get the infection? What if I get the infection? So dysentery compound in cases where you haven't had benefit with that, with arsenic or argentum nitricum, and also scutellaria, you know, like, you know, I had to go out today and I'm having palpitation after coming back. What if I get the infection? So prescribe scutellaria as well for that condition.
For the teenage, I think the question is same asked regarding that. There's one question, I think it's out of topic, but can be relevant. What is the difference between capsicum and acid Phos in cases of homesickness?
Good question. Again, phosphoric acid is, as I shared with you, becomes more indifferent with, you know, phosphoric acid has emotional, intellectual changes with homesickness. Emotional in terms of indifference, intellectual in terms of poor focus, motivation, concentration. But in case of capsicum with homesickness, there's more emotional changes which happens. So they become more irritable. You know, it's prepared from cane pepper. So it's like a peppery disposition you'll find with capsicum. To become more irritable, more abusive and accusive with homesickness in case of capsicum. And sometimes they become totally sluggish and indolent. You know, sitting in front of the television, they don't want to go out, they don't want to move out, ordering online food. So become totally, totally indolent as well in capsicum as well.
There's another question, sir. Medicine for persons who think that they will definitely be affected with COVID.
It's more like a fixed idea. You know, we don't have anything specific, I will say, for that condition. But you have to think of, it's more like an anxiety which has turned into a fixed idea. So sometimes a remedy like arsenic can help you. Sometimes thuya can help you as well with that condition as well.
Insomnia in COVID.
I talked a lot about that. Actually, I shared with you Avena, I shared with you Phos, where you have insomnia, scutellaria. Those are all medicines for insomnia and COVID.
Okay, sir. I think the questions are over, I think.
Thank you.
So, sir, it's a great session we have. Actually, it's been 1 year, but I feel like it's just like yesterday. The 2 sessions you have done for the column was excellent, and many people have suggested your name in the season 1. Actually, we contacted you, but due to the cyclone, you are not able
didn't have proper internet.
Yeah, actually, you are about to come in the season 1, but this was an excellent session. On behalf of IHMA Kerala and IHMA Kollam, we sincerely thankful to you, and please do sessions like this for us in any time. If like this COVID in this COVID time, many people like people from north and south, many have come to our platform, and this was an excellent session. So once again, thanking you. Thank you, sir.
Thank you. Thanks a lot.
Sir, one more, sir. One. Can I upload this in YouTube?
Yeah, sure.
Okay. Thank you, sir.
Thank you. Thank you. Bye.